Hello, everyone. Thank you for joining us for this month's webinar for the Food Insecurity Learning Cohort. My name is Monique Van Blericum. I'm the Associate Executive Director at the Root Cause Coalition. I just want to thank you so much for being participants of this learning cohort, of the webinar, and hopefully of the discussion forum on Forum B. I'm going to pass it off to Alex Lewin-Zwerdling and our panelist presenters here today, but just want to thank you guys so much. If you have any questions, content related, feel free to reach out to our panelists. Anything related to the learning cohorts itself, logistics, please do not hesitate to reach out to me or Alex. We're so happy to have you here. So Alex, take it away.
Super, thanks Monique. Hi everyone, and thank you so much for attending today's Food Insecurity Learning Cohort webinar. As Monique said, my name is Alex Lewin-Zwerdling. I'm working with Root Cause on this year's Learning Cohort series, and we're thrilled to have all of you participate and have with us two really wonderful presenters who I'm going to introduce shortly. Following today's presentation, we'll continue the conversation as usual via Forum B, the online platform that Root Cause has set up to share thoughts, perspectives, and resources on this topic and others related to food and housing insecurity. So if you need any help logging in or navigating Forum B, please don't hesitate to reach out to Monique or myself. Also, just quickly in terms of housekeeping, today's speakers will present for about 40 minutes, and that will leave some time for Q&A. If you have a question, please enter it into the chat box in the GoToWebinar platform, and I'll field the questions as they come in at the end of today's webinar. You don't need to wait until the end of the presentation to add your question. Also, following today's presentation, you'll receive an email from Root Cause with a link to a short survey to provide your feedback. So thank you in advance for taking a few minutes to complete it. And as always, please be an active participant on Forum B. Today's webinar will also be recorded and posted on the Forum B site within the week. So I'd now like to introduce our two wonderful speakers. Jessica Hager currently serves as the Director for Healthcare Partnerships and Nutrition at Feeding America. At Feeding America, Jessica's work focuses on the development and execution of a national strategy aimed at improving food security through cross-sector partnerships, applied research, and hunger relief sector transformation. Jessica has also developed the Hunger and Health website, which is designed to educate, connect, and engage cross-sector professionals addressing food insecurity. We also have with us Jennifer Spear. Jennifer is the Population Health Strategy Lead with Humana's Population Health Team. She has a diverse background in business, sales, and marketing, and is in charge of executing interventions and programs that address food insecurity in Humana's member population and the communities they serve. She also works closely with community partners, the clinical community, and others to address health-related social needs, specifically food insecurity. So with that, I would like to turn the presentation over to Jessica. Thanks so much.
Thanks, Alex, and it's a pleasure to be with you all today. When approached by our friends at the Root Cause Coalition, Jen and I were asked to speak on turning theory into practice. So in other words, how did Humana and Feeding America turn our dreams and visions as an organization into a reality through our work and a partnership together? So we aim to leave, again, at least 20 minutes for Q&A together at the end. We also look forward to continuing the discussion on Forum B after today's webinar. And to second what Alex was noting, these slides will be available. So just want to make note of that. So Jen and I hope that through today's presentations, you as attendees will be able to learn how a healthcare company and nonprofit organization have successfully built a mutually beneficial partnership focused on addressing social determinants of health, increase understanding of our partnership's journey of moving from intervention exploration to execution with the aim of filling the field's knowledge gaps, and also a time for engaging in question and answer with us during the second half of the call. Next slide. So for those who are not familiar with Feeding America, we are the nation's largest hunger relief organization with our national offices located in Chicago and Washington, D.C. Our work is really only possible through a nationwide network of 200 local food banks, 60,000 feeding programs, and one national organization. Together, we provide meals to more than 46 million people each year, including 12 million children and 7 million seniors. For our vision, we envision a hunger-free America and fully recognize that though we have a great reach and depth of trust in individual communities across the country, this vision is only going to be possible through strategic and successful partnerships, such as that which we've fostered with Humana over the last several years. And as the Director of Healthcare Partnerships and Nutrition at Feeding America, I've had the honor of executing one of the organization's 4 core strategy pillars called Nourish. And the focus of the Nourish strategy is to ensure healthy choices for individuals. The healthy choices are the easiest choices, and we measure this through improved diet quality and healthy days. Our key initiatives to achieve these outcomes include activating healthcare partnerships and scaling the implementation of nudges or behavioral cues in an environment to make the healthy choice the easy choice. I'm more than happy to provide more context on this during the Q&A. But Feeding America and Humana's partnership has been a cornerstone example of how community-based and healthcare organizations have come together with aligned aims with population-level outcomes and the needs of individuals experiencing a social determinant of health front and center of our work and learnings. And so at this time, I'll pass it on to Jen, who will share more about Humana and their bold goal.
All right, thank you all. I'm excited to be here today and share some of this work that Humana and Feeding America and the local affiliate food banks have been able to accomplish over the last 5 years or so. So just a little bit about Humana and our bold goal. About 5 years ago, we really set this bold proclamation to improve the health of the communities we serve 20% by 2020 and beyond. Doing this by achieving more healthy days throughout communities, through business collaboration, community collaboration, scalable and evidence-based solutions. So we believe that change to the health of a population comes through collective impact, through these partnerships with the community partners, physicians, healthcare, for-profit, universities, academic partners, all of those groups coming together to solve for a common problem. Whenever we first launched this, we really, had to realize that there were, within the communities we serve, every community is different, and we had to figure out how to really make the most impact. So we looked at the Robert Wood Johnson information on social determinants of health and backed that up with our real data that we have from our members. Through that, we were able to identify food insecurity and loneliness and social isolation as the biggest areas of impact for us to improve the health of not only our members, but in doing so, the communities around us. So that's really what led to this work with Feeding America and the food banks and other partners throughout our Bold Goal communities. I will just note quickly, we have 14 Bold Goal communities now. And when I say Bold Goal communities, that's really where we are going very deep into those communities. We have boots on the ground there, a local resource who's really leading that work because, we know that the population of South Florida is going to be different than San Antonio, is going to be different than Kansas or Chicago. And so really taking that localized approach to solve some of these issues and to address the issues at a community level is where we see our biggest area of impact. So next slide. So I'm just going to start, and Jessica's going to chime in here. So obviously we have Humana and Feeding America represented, and how we kind of took this bold dream, pie in the sky idea and really put that into practice. So I love the story of the start of our work together. So my predecessor actually reached out to Feeding America through a contact form on their website and just basically said, we are looking at food insecurity. We're really trying to figure out how to address food insecurity in a healthcare setting. Do you want to partner? And so that led to really the work that is happening now. And so, as I mentioned, when we first looked at the need to address food insecurity in a healthcare setting, the first question for us was, is that going to work? Are people willing to talk to their physician about food insecurity in a healthcare setting? And so that's really where we started our conversation with Feeding America, is trying to figure out what collectively we could do to address that. So Jessica, I'm going to turn it back over to you from your side of kind of the original dream of the organization from the Feeding America side.
Absolutely. So, for those who are not as familiar, when Feeding America started around 40 years ago, it's really about recognizing that there was an excess of food, and folks who are experiencing food insecurity, or colloquially, of course, we say hunger. And but that work has evolved, and so Feeding America started our nutrition team in 2011, which in some ways seems like a really long time ago, and others it doesn't. But with that start of the nutrition team formally began our more intentional focus and journey of learning and programming surrounding social determinants of health. And so as stated earlier, we recognize partners as a key collaborator to the success of population and individual level outcomes for what we hope to achieve. We knew with the changing landscape of healthcare and the increased local focus of food banks and benefit outreach such as ACA, SNAP, WIC, etc., the healthcare sector was increasingly a natural partner for exploration. So that was a dream of what would it look like to work with healthcare. Of course, that's easier said than done. So as we all know, large, complex, multifaceted sector. And on the food bank side, the makeup of our full-time staff at Feeding America back in 2012 included 0 health professionals. And there were only a handful of health professionals serving as full-time staff at food banks. And that was 2012. We had lots of questions, basic questions about healthcare lingo, relational questions about who to contact at hospitals for discussing, being at the table for community health needs assessments and improvement plans, and then more complex questions pertain to how various entities and policies functioned across the healthcare sector. All of these questions came with the intention of better understanding where hunger relief organizations could best fit for a partnership in the healthcare sector. We knew that there was potential and, of course, a deep need, but we're trying to develop a line of sight for how to get there. And so this is where Humana enters with that contact us form that we received on our end. And just like Emily McGrath, who started this work on the Humana side, the 2 staff members that we've had at Feeding America that started this partnership have since transitioned. And so I think the reason when Jen and I were preparing for this webinar, we were talking about what a great sign of the kind of how deep this partnership and the value of it runs through each of our organizations, that in spite of these, the kind of original champions of this partnership no longer being in their particular roles or at the organization, this work has continued through ourselves and through others as well. So that's kind of the dream on the Feeding America side, and that started the national partnership. So Jen, back to you.
Thank you, Jessica. Yes, and so as Jessica mentioned, this really has continued from the start, and it's evolved and it's grown, and really excited to present to you all kind of the start of a national partnership and then how this has moved into local partnerships. But from the perspective of the start of the national partnership, I mentioned that when we first started looking at this work, we Humana, and addressing food insecurity in the healthcare setting, a lot of you on the line are probably thinking, this as partners like the food banks and local healthcare partners, they have been looking at this for years. And so for us, when we've got on board and we're really taking a look at how to address these needs and how to meet people where they are, and for us, often that's when they're coming to their physician or they're seeing someone within their care team, how do we really provide impact at that point? And so we really had to understand both organizations. And, Jessica mentioned learning healthcare lingo. We, on the Humana end, had to learn food bank and community-based organization lingo. Also to understand around capacity needs, and that, we can't just refer a lot of people to a food bank that's already strapped with some capacity issues, that there has to be that support on both ends in order for these types of partnerships to work well. We had to level on all of our expectations, and within the expectations of not only our business, but Feeding America, and then also the communities we serve, the physicians that we are working with, the clinics that also have needs that need to be met. And so a lot of this work has had a lot of moving parts and a lot of different partners, because when we think about healthcare, there are so many facets of healthcare, and there are so many people that are touching various members as patients, as you think about a pharmacist who's seeing members and seeing patients each time they come to get their prescriptions and different nurses and dietitians. There's so much that we had to essentially walk before we could run. And so I think that by aligning on all of those and then really aligning on what the shared goal was, we all wanted to address food insecurity and hunger in the healthcare setting. And so when we were able to level on those shared goals and then move from there is where we really saw the traction, and to say, we want to answer this research question, let's start here, and then we'll build. And that's really how this partnership has grown.
Great, thanks, Jen. And similarly on Feeding America, if you've heard me speak with other things recently, I've been talking a lot about different adaptive versus technical challenges and kind of solutions, whether we address a solution from an adaptive lens or a technical lens. And I feel like when, Feeding America started building partnerships around healthcare, we really had to take a step back and relook at how we even cultivate partnerships. Historically, as an organization, we've worked, our relationship managers live on the fundraising side of the house. And so we work with partners to, receive donations, and those donations are used to give out member grants, millions of dollars worth of member grants to our food banks, and do programmatic work here at the national level as well. And with healthcare, in all transparency, many of you know, there's money behind that. We really had to take a step back and say, that may not always be the case. And though there may be some funding, we can't anticipate and only look at healthcare as a funding partner. And so one thing that I have so valued about the relationship between Humana and Feeding America is we've had a lot of transparency and trust within each other to be open about each of our systems, ways of working, and also kind of leaning in with agility and flexibility with also time. And this was really rooted in, again, both of our organizations having champions behind the end result and the communities that ultimately are being served and the results we're trying to achieve collectively. And so, again, this, to just underscore what Jen was saying, it was the champions, the agility, being flexible with time. But again, we had to have a paradigm shift at Feeding America of knowing that this is a wonderful partner, and it doesn't necessarily come with the same traditional elements that we have looked to in the past for partnership. And so that is not only what helped us from build our national partnership, but then also re-exploring Feeding America's role in supporting as we transition from national to local partnerships. And so at this time with our partnership with Humana, we serve as an advisory role. We recognize that Humana comes to the table with so much expertise around the healthcare sector and research, and Feeding America comes to the table with a lot of expertise around the hunger relief space and the experiences of individuals experiencing food insecurity and food banks and research in that area. And so it truly has been a partnership that is equal and hand-holding along the way. And on a tactical standpoint, that looks like monthly meetings that we connect and just continue to build relationship there, but also continue to explore what our next opportunities could be together based on the evolving research within the sector and individual community needs. And so that is a nice tie to kind of how work at the national level, which we'll speak to in the next following slides, but then transition into local partnerships.
Thanks, Jessica. All right, so actually if we can go to the next slide. So we're going to kind of talk through what some of these partnerships from theory into practice have actually looked like. So I'm going to talk about this is really our first pilot project, if you will. We call it our early learnings pilot. And this is really where, Jessica mentioned, we all had a lot to learn from each other. Feeding America learned from Humana on the healthcare front on, ways we could share data, ways we can collect data, the way that Humana looks at doing research. Humana had a lot to learn about how food banks work, how they operate, what staffing models look like, what staffing models might be missing. We also had a lot to learn about our physician partners and the capacity that's there. So what we really wanted to look at is if food insecurity screenings and referrals would fit into the natural workflow of a practice. Would patients even be receptive to screenings and referrals to a Feeding South Florida representative, which is the Feeding America affiliate in Broward County, Florida, in South Florida? Would patients be open to learning more about how to navigate the food assistance system? And then for us, that first study, we wanted to better understand if there was a correlation between a member's or a patient's unhealthy days and food insecurity. And so for those of you who might not be familiar, Humana and others, Jessica referenced this in their Nourish program, we use the CDC's Healthy Days tool, questions asking about a member's physical health and their mental health, and the number of physically unhealthy days they experienced in the last month, mentally unhealthy days they experienced in the last month. That's what we really use as one of our leading indicators in pilots. And we also have used healthy days as a way to assess the correlations in health between some of the social determinants of health that we've looked at and our members. Because Jessica mentioned, we have a lot of data that we can bring into study, and we can bring that lens into a lot of our pilots and research. But the first thing we wanted to better understand was there even a correlation in this? So were food insecure members, did they also have more unhealthy days? So, as Jessica mentioned, we worked together a lot. We had someone that was on the Feeding America side who was, really she had spent some time in practice. So she was able to bring some of that clinician perspective of, what might work and what might not, and kind of to help think through some of the barriers that we might not have thought about or that might be coming whenever we started to look at this pilot within some clinics. So we looked at a 4-week, I say pilot, but really what we were doing was screening and referring members to an on-site representative from Feeding South Florida that was in the clinic. That person was able to connect those patients to resources. And so one thing that I'm really proud of within this and the next project that we embarked on is that whenever I say, we were in these clinics, this was every patient that the physician was seeing. So this is not specific to Humana members. We really just wanted to get a better understanding from that community about food insecurity, its correlation to health, and then if those patients were receptive to the screening and also the referral to assistance. So what we found, though, was that patients who screened positive had twice as many unhealthy days as those who did not screen positive for food insecurity. And the majority of those who screened positive were receptive to intervention. And so on the clinician side, we found that these physicians and clinicians, whoever was screening in each clinic, were really grateful for another way to help their patients. I think that in the years since we've done this and in working with all of the food banks and everyone realizing physicians want to have the answer for their patients, but they don't want to ask a question that they don't have a good answer for. And so I think that some of the findings from this study really helped to show that referral to the trusted food bank in the community is one way to address the needs of these food insecure patients that the physicians in the clinics are seeing. So just quickly by the numbers, we found that 46% of patients screened positive for food insecurity, and 86% of those accepted a referral to meet with a Feeding South Florida representative. Of those that met with the Feeding South Florida representative, 94% accepted an emergency food box. We also found that patients had 2 times more, food insecure patients had 2 times more unhealthy days than those who screened negative for food insecurity. What this really showed us, though, is that not only were patients willing to accept help, if you will, but that they really trusted that Feeding South Florida representative. This is who is in their community and who they see showing up and who's really that trusted leader to address hunger relief within their community. And so this partnership would not have gone the same way if, for instance, Humana just tried to do this and on our own with the clinic. So it really took all of these partners together for this to be successful. Jessica, anything you want to add about the test and learn?
No, that was great, Jen. Thank you. I mean, I could underscore all the things you said, but I know we're on the time, so no, it was great.
So then this study led to a 12-month randomized control trial. And so what we were looking at here was how could screening patients for food insecurity, they were asked to participate in a program, randomized into a treatment and control group. Members of the control treatment group received more of a case management approach to accessing resources through Feeding South Florida. So more around, making sure that they were reminded they had access to certain things. Some produce that were added to mobile distributions within their communities. And so when Jessica and I were really planning for this, I think that we always tout our successes, but we also have to think about things that none of us might see coming. And so we really put a lot of work and thought and partnered with the community and the clinical community on all of the things that we thought needed to happen. And what we found that, patients. So in this instance, everyone in the clinic was able to participate, everyone who screened positive for food insecurity. But what we found were some barriers that we didn't foresee. So for instance, in some of the assessments, we found that in the follow-up assessments that patients weren't accessing some of the resources because transportation and potentially the hours of availability were a huge issue. So even though someone was calling them and reminding them and really helping to drive them to those resources, they simply couldn't get there. We also found that, whenever you have a lot of different partners, and so in this instance, we ended up partnering with 9 clinics. And so that's a lot of people that are either screening or referring members, or sorry, I keep saying members, I mean patients, but referring patients to the resources. There's a lot of room for error then. And so while, we had clinic leadership buy-in, at the end of the day, you have to make sure that that's trickling down. And so we learned a lot from this. And also, I always say we started planning for this in 2016, launched in 2017, and it was really a very different landscape than what we have now, especially on the healthcare side. There were a lot of issues, and we're still working through a lot of things like data sharing and how do we, efficiently share data that the health plan has, that the physician has, that the food banks have, and that the food banks really need in order to best address the needs of their clients. And so I still think a lot of that's being worked out, but I think that one of the things we certainly learned from this pilot was that there was a lot of work and a lot of opportunity within that. And so due to perceived low engagement, and so some of this comes in that tracking and the ability to follow a person from the time they enter the study to the time that the study ends, and make sure that all of those data points are being collected in the physician's office anytime they're coming in for a visit. So that's why I say perceived low engagement, is because there could be a lot of really great things that did happen for all of those patients that were enrolled, but because of some of the data issues and abilities to get that back, it seems as though there was low engagement. And so I think that's something that, between the transportation piece and hours of availability, and also really taking a look at how to address some of these issues with data collection and dissemination, has really led to how I know Feeding South Florida is now really looking at more of the mobile distribution and a mobile truck, because they really heard from a lot of the patients that were in the trial that they just couldn't get to a lot of the distribution sites. And so I think that taking all of those learnings and putting those into practice for future pilots and partnerships is really where we have gone as a group. And, Jessica mentioned we have monthly calls. It's taking all of these learnings and addressing those within it to help determine and help drive towards where we go from here. So, Jessica, anything else to add on the randomized control trial?
Yeah, so I'll just kind of as Jen mentioned, this work started in 2016, and of course, our world has changed so much since then. And specific to transportation, this study underscored the need for us to explore transportation options, whether that be food delivery or helping individuals get from point A to point B through various transportation options. And we've seen various healthcare partners and community-based organizations explore this question as well and potential solutions. So it was really valuable to, we've heard anecdotally from folks in our kind of senior design labs or rural design labs or with families with children and healthcare. When it comes to barriers, transportation cuts across all of them. So it's not some unique thing when it comes to individuals who are experiencing food insecurity engaged in healthcare. And so that really was a signal for Feeding America as we explore addressing barriers. What are the ones that cut across all populations that we serve? So, that was a great learning that we've continued to carry with us through our strategic development. And then when we talk about referrals, there's been an increase, certainly since 2016, but how we not only have referrals, but the feedback loops with the referrals. And this speaks to the data sharing and also HIPAA. And so we've worked with Chilpy on materials and resources on hungerandhealth.org around for food banks to be kind of educated and aware of what are the implications around HIPAA and the opportunities there to be engaged in this work and feel really strong about what they're developing and how they're engaging. So again, even though it's one trial, it speaks and underscores a lot of what we may be hearing through other conversations and again, just keeping this work moving forward. I think we're good for the next slide here. And speaking about moving the work forward and kind of helping empower folks with information, Humana and Feeding America set out to develop a food insecurity and health toolkit. So this is a toolkit for physicians and healthcare organizations. Certainly this is great for Humana with their clinics that they work with and the physicians, and also Feeding America has placed it on hungerandhealth.org, which Alex mentioned in our bios at the start. So this toolkit, it was this was developed several years back and it gets updated regularly. The next one will come out in mid-April of this year. And so now there's several organizations that are creating similar toolkits. And so I think that's a great sign, right? Yet there may be some duplication, but when Humana and Feeding America first set out to do this, it was not a toolkit that I had seen currently existed. And so it speaks to the connection between food insecurity and health. Of course, as you can read here on the slide, how to implement screenings in a clinical setting. So screening for food insecurity, how do you train clinical staff about that? How do we incorporate it into the EMR system? How do we incorporate screenings into clinical workflows? And we're studying kind of that component now, and then measuring success. It also provides an overview of food assistance programs. So as many of you know, this is not something that medical staff get trained in school. Not nutrition and not food assistance programs. So how can we bring that knowledge into the medical setting? And then certainly how to partner with community organizations and food banks. And so though there are some foundational elements of food banking that are similar across the nation, each food bank is their own 501c3 nonprofit, and they function in very different ways based on their own community needs and their own capacity as an organization. And then subsequently, the pantries within their network are very different. So this toolkit speaks to those nuances. Should this be helpful to your organization, we do have a resource slide at the end of this deck, and we'll also put it on Forum B, so you can click and link to it. And again, the latest version will come out in mid-April. Next slide.
All right, and I just want to touch quickly on one of our local partnerships. And so I mentioned we have 14 Bold Goal communities, and Kansas City is one of them. Erica Anderson leads our work in Kansas. And the other thing that I'll add is, through this national partnership with Feeding America, and I sit in Louisville, Kentucky, leading our corporate food insecurity work for the Bold Goal, we have those 14 boots on the ground local resources, and they are all partnering with their food banks in different ways. And so, for instance, in Kansas City, Erica and Harvesters really identified this need to address food insecurity with some of their physician partners, different healthcare partners. And so you can see on the slide that between 2 clinics and then also a YMCA. They have distributed over 153,000 pounds of food within the last year. I think the really cool thing too about our partnership is even some of the things that Humana brings that aren't necessarily what we would typically think about. So you see 117 Humana hours volunteered. We have about between 45 and 50,000 employees across the country. And so when we take all of the focus of volunteering and being able to make an impact in the communities that we serve, we find that that's a lot of man hours behind some of that. And so in Kansas City, when Erica and Harvester started working together, you think about that capacity issue that we talked about earlier, and how can those volunteers also help to impact some of that. So they have worked within these mobile distributions. So again, getting the food out to where the community members are already coming. So they're already getting to their YMCA. They might be coming for a Silver Sneakers class. They might be coming for a DPP program or something like that. And being able to provide food at that point instead of something, in addition to. So Heartland Primary Care and Elati Medical, being able to screen for food insecurity, but then have that response of a place that those patients can come back and take part in those mobile distributions at a later time. So that's just one of the local partnerships. Erica and Harvesters have really worked to make sure that this is successful in addressing some of those other issues that Jessica referenced. So making sure that we're able to understand who's getting referred and how this access to food is impacting their health, making sure that the mobile distributions are in the communities where these patients and community members already live and where they live, work, and play. And so it's meeting them really where they are and bringing food to them versus anything else. So this is just one of the local partnerships. We only have an hour, so wanted to just highlight this partnership, and Erica and Harvesters are working on a lot of other things, but this is one of the most, the oldest projects that they have worked on since we've worked in our Kansas City Bold Gold Market. We can go to the next slide.
Thanks, Jen. And just as we jump into resources, and then we're doing great on time, so we'll have 20 minutes for Q&A, is, this really comes back to when we talk about turning theory into practice. From Feeding America's standpoint, and Jen, you may say the same from Humana, this work around addressing social determinants of health is only possible through strategic and effective partnerships. And so we're so pleased to have changed our way of approaching partnerships to be able to partner with Humana and to, again, explore at both the national strategic level and also the local level, and kind of ensure that the power and the voice is still within communities and doing this work that they've been doing long before Feeding America got here, and continue to, and exploring what's our particular role in this. So again, Humana has been a great partner in that, and our food banks. And so thank you to those who are on the call today that are representing those communities. So as we look forward, I just wanted to highlight some resources. One is, you may be familiar with Seth Berkowitz and Hillary Seligman, both of which are researchers leading work around food insecurity. And there is a public Tableau page that Feeding America created based on their research, which looks at the state and county healthcare costs of food insecurity. And so, it's over $50 billion a year is the additional healthcare costs associated with food insecurity. And so, of course, this is a staggering number. And so if you are in your state and looking for your state or county healthcare costs, I encourage you to go to this link. Again, this will be on Forum B within the next few minutes after our call today. But it's a great, again, visualization page to look at. We also have had some blog posts written by our partners at Humana or in relation to the work that Jen spoke to today. So we'll post these 3 blog posts from Hunger and Health online, so that, or on Forum B, excuse me, so you can check those out. And then again, here's the screening toolkit that is available. So if you click on it today, you'll see the current version, and mid-April, please visit the same link and you'll see the latest version of the toolkit. For those Feeding America food banks that are on the line today who are not already part of our healthcare partnership community of practice, just wanted to share this resource with you all that we convene once a month to discuss healthcare partnerships and opportunities and the role of food banks in engaging in improving dietary quality and healthy days. And then last but not least, coming this spring and summer, we are rolling out recommended protocols for implementing medically tailored food packages and separately recommendations around SNAP application assistance, implementing SNAP application assistance through healthcare via food banks. So these protocols will be released this summer, again, via hungerandhealth.org. And then the last element is we have a partnership toolkit. I mentioned at the start of the call, Feeding America's work around both nudges and healthcare partnerships. And so we have a toolkit for food banks and others who are interested, but how to engage with partners. What does it mean to kind of have a data sharing agreement or ensure that you're aligning with HIPAA? So all of these resources will be kind of combined and published this summer. And then last but not least, we will have an evidence review. So building off some work that Siren did around a systematic review around interventions that address food insecurity in healthcare, we are kind of broadening that evidence review. And so it will look at interventions that address food insecurity, specifically looking at improving healthy days and diet quality in the healthcare setting. And this evidence review will certainly pull from peer-reviewed journals, but we also recognize that there's some really great work that's going on by community-based organizations, but doesn't always go through the process due to cost and timing and et cetera related to getting reviewed. And so that work will be all compiled and be part of an evidence review where we will rank what is promising and proven interventions for consideration for this work as we continue forward. So with that being said, I know we are at 12:42, so would love for us to open it up. I know Alex and Monique have been managing the chat box, so I'll pass it back off to our friends at Root Cause.
Wonderful. Thank you both, Jennifer and Jessica. That was really great. I enjoyed the tag teaming and how much you collaborated on the presentation. So thanks for that. There are a couple of questions already in the chat box, so I'll just pull them out in the order that they came in. And I think all three so far are related to the randomized control trial. So just the first one, a participant asked, what did the control group receive if not the case management intervention?
Yep, so the control group received like a list of resources. So they actually had access to the mobile distributions, but what the treatment group got that was different was kind of someone calling them and reminding them, and they also had monthly access to the client choice pantry.
Super, thanks. And I'll just do a quick reminder for anybody who jumped on a little bit late. If you do have a question, please share it in the chat box and I'll take them in the order that they come in. So thanks for adding it there. Just a quick note, question about whether or not the study's been published.
It has not. So as I mentioned, we will not be moving forward necessarily with publication just based on perceived low engagement. You know, as I mentioned, there were a lot of issues with collecting some of the follow-up data. And so that's really, you know, what we're working through in future iterations of work is when we have so many partners, as I mentioned, you know, 9 clinics who have, you know, multiple physicians and everyone at those, that some of that data collection at the time, so again, back to the point, this was 4 years ago now when we started discussions, was very different. So it's just really at this time when the data that we have is not powered appropriately for a publication.
Great, thanks. And then the third question that's come in says the following: is there any data on the uptake of screening as a result of the toolkit? And then also, are healthcare organizations motivated to make this happen and create local partnerships with food banks?
So I can speak to the first piece, and so we track really more so around like the number of downloads for the toolkit. We've used it in a number of meetings with healthcare partners. And Jessica, I don't know if you have anything else to add. I don't know that we're necessarily tracking the number of screenings that are happening, but that would be something really good to look at. Sometimes we don't have views into that necessarily. More so it's around the conversations and the trainings that might come from either Humana or our local partners in the communities we're serving. But at this time, I don't think that we really have anything around the increase in screenings that come from the toolkit.
Yeah, and I can't speak, not to say it doesn't exist out in the world, but I can't speak to a specific survey or study that we've been part of related to seeing an increase in screening based on either this Humana Feeding America toolkit or another one. I will note that in 2018, the fall of 2018, Feeding America did a survey with our 200 food banks, and more than 50% are actively engaged in a healthcare partnership. That can mean a lot of different things. Not all are necessarily a screen and intervene intervention, but certainly anecdotally, it's just being part of this conversation in the sector more and more and more, whether it's in rural or big healthcare systems, in urban settings or suburban settings are increasingly engaged in food insecurity screenings. And we are also seeing, again, anecdotally, that, a few years ago, I would hear folks say, well, in healthcare, like maybe that's food insecure patients aren't part of our patient population. And I think there's increasingly a broader understanding that, in fact, food insecurity does exist in every single county, and you will come across patients perhaps at different percentage rates or levels that are experiencing food insecurity. And it's a very important data point to better understand. So, and a lot of times this work is being, the screening in of itself. I know this expands a little bit on beyond what you were asking, but it's not always done at the physician level. It may be. I was recently at our anti-hunger policy conference, and a pediatrician was saying that one of the partners she works at, it's really the nurses who do the confirmation calls for appointments. That's when they do the screening. So it really looks differently at each location and in each community based on their needs. And again, going back to that, who's the champion for this work?
Great, thanks. And then another question's come in about the assessment tool and whether or not that was something that's been designed by Feeding America.
And maybe just refresh me. So when the question was talking about an assessment tool, what assessment is that speaking to?
The question itself says, can you comment more on the assessment tool? Was it designed by Feeding America? So I'm not totally sure. And
I'm very happy.
In the health, she's adding, in the healthcare setting. Yeah.
So I'm not sure that I'm still understanding the question, which could totally be on me. So very happy to get clarity on what that question is. And my email is jehager@feedingamerica.org, and very happy to have this conversation offline, just so I make sure I'm answering your question appropriately.
Okay, perfect. Thanks. I had one question for you guys. You talked a lot at the beginning of the presentation about having the champion from Humana and Feeding America to kind of help serve as catalysts to keep this partnership strong and going. And I'm wondering what kind of legwork was necessary internally to kind of build those champions, or if they came more naturally, and whether or not that was sort of a big lift, or how that works to develop those champions to want to make the partnership happen.
So I can start, Jessica, and then kick it over to the FANO side. So on the Humana side, so as I mentioned, about 5 years ago, our CEO declared, that we were going to improve the health of the communities we serve 20% by 2020. So really it's had to be a top-down approach. Obviously I work under the Bold Goal team. We traditionally reported up through the Office of the Chief Medical Officer. A lot of that was really easy to get those business leaders on board. But then there's a lot of other business leaders within Humana. And so, I think when we really started on this work, kind of to the point of what Jessica was just saying about clinicians, a lot of our leaders didn't think that Medicare Advantage members were food insecure, quite frankly. They didn't think that that was probably an issue that our members were dealing with. And so it's taken a few years to really, first of all, acknowledge that that is something that our members deal with, and in more frequent cases than we might think. And then also that the place to address this and the partner to address this with is that local resource. So instead of, Humana designing a fix, if you will, or designing an intervention, to really take it to the community, empower and make sure that we are supporting the local food banks in a way that allows them to do what they've been doing for years. And so that has been, I wouldn't say, it was hard to get them on board, but it's been we always say that we're in this for the long haul. So minds weren't changed overnight, but through the continued work that we're doing with Feeding America and the local food banks, when we show, the innovative interventions and the work that's being done at the local level, I think that only continues to build the case of why this partnership is so important. And then also from the research side, we all have worked very hard to make sure that the research that we're all looking at is innovative interventions, and it's new research, and it's needed, and it's adding to the body of work, which in turn, speaks volumes to, at least on the Humana side, our executive leadership and leaders.
Mm-hmm. Mm-hmm. And I'll add for the Feeding America side, this was really our first substantial healthcare partnership. And so what was in place back in 2016 when we began these conversations is that, again, our team had just started in 2011, nutrition team. We did have a goal at that point, a 2025 goal. But the strategy, the Nourish pillar, which I spoke at the top of this call, that wasn't yet ironed out or solidified. So this is really our leadership saying, all right, we know that this is important. We know that there's a connection between food insecurity and health. Our priorities at Feeding America are to continue to learn from individuals experiencing food insecurity about their circumstances. So that was a driver for us. We also know that it's increasingly important to expand access points to nutritious food. And then, of course, the network was looking to us, asking lots of questions about healthcare. And so we saw this opportunity with Humana to be dipping our toe in the water and saying, all right, let's see what we can do and learn. And our leadership trusted the team. I also would be remiss if I did not give credit to our wonderful consultant, Kim Prendergast, who came with some healthcare experience to this work and was really that initial champion for Feeding America. To build this relationship and work with Emily, Jen's colleague, on this work. And so that was 2016. And I'll note now, we just about 5 weeks ago, Feeding America hired a new position at the organization, our Vice President of Healthcare Partnerships and Nutrition, and really focused on health equity. So again, we continue to evolve, and a lot of this is due to the growing recognition stemming from this cornerstone partnership around the value of this work and the opportunity in service to individuals experiencing food insecurity. And we've subsequently also seen our network of food banks increasingly build their senior and at all levels staff that have a focus on health and nutrition.
Great, thanks. That's really helpful. Let's do one more question, and then we'll close out at just a couple of minutes early. Root Cause has back-to-back webinars today, so if anybody's interested in joining the health equity webinar at 2, Monique has that information, so please reach out to her if you're not registered. So let's do this last question, and it comes through the chat box. What would be the best way, and this is a big question, I know we just have a couple minutes, but what would be the best way for a food bank to attract a healthcare partner?
That's a big
great, yeah. So Jen, I don't know, on your side if you want to start, or I can start, whatever works.
Yeah, Jessica, you start.
Okay, great. So I would kind of reframe it around, well, maybe not reframe, but I'm like, oh, how would you attract? I'm thinking dating, right? So I think one thing is, food banks and food pantries are such trusted partners in communities and trusted by fellow organizations. And also, I would say, most importantly, trusted by community members. And so food banks and community-based organizations have a lot to bring to the table and should stand strong in knowing you are an equal partner in this process. And so I think sometimes we think, oh, healthcare is such a big entity, and so there's this differentiation with power, and certainly I acknowledge that. But know that my experience in talking with food banks is that they, the successful partnerships are the ones where they're able to come to the table and there's that mutual benefit that's seen by each party. And so I will say it's about relationship building at the onset. And this can be just finding whether it's, a technician or a nurse or physician or the CEO of the healthcare system. But who is that champion? And that takes time, years sometimes to figure out who that person is. I would say at this point in time, there's a general recognition. We hear less and less folks saying, man, we have to go and do the 101 about the intersection of food insecurity and health and that connection. I think that's pretty well grounded in most communities related to healthcare now. So it's really, when we've talked with healthcare, they're saying, okay, what's the quote unquote product? Like, what can food banks do to help this be implemented and streamlined? And this is where the Humana toolkit, and again, there's many other toolkits that have now been developed, but how to engage and implement a quote unquote product, let's say screen and intervene in your community. And it could start in a very simple way. The referral initially may just be someone gets screened for food insecurity, they get referred by a list to the local food pantries, and those food pantries are given a heads up and approved that their name will be on there for capacity's sake. But that partnership can build to referrals for SNAP application assistance with the food bank. So just consider if you're at a food bank, if the person asking this question is from a food bank, what is your readiness and capacity that you're willing to kind of pitch or sell or offer up to a community organization so that that relationship can build in a strong way from the start? Jen, open to your thoughts too from the healthcare side.
Yeah,
that's really helpful. That's really helpful. Go ahead, Jen. We just need to wrap up in about a minute or so.
Yep, I was going to say, I know we're at time. I would completely echo everything that Jessica said, and I think that the one key thing is that time piece and that relationship piece. And, still, 4 or 5 years later, this takes time and working out to figure out what is mutually beneficial to all parties, where the opportunity is, and building from that. But time and patience, I think, is the biggest thing to consider as well.
Wonderful. Thank you so much to both of you. I think we got through all of the questions in the chat. This was a great presentation, and I look forward to the continued conversation on Forum B. So thank you both very much, and go to Forum B if you have any other follow-up questions, comments, resources to post, etc. We'll continue the conversation there. So thanks again, everyone, for participating, and have a great afternoon.
Thank you.